I'm Rick Hayden, the Director of Education for the Center for Regenerative Medicine at Mayo Clinic. Regenerative medicine is really an exciting new approach to not just healthcare delivery, but many of societal problems. And Mayo Clinic has been dedicated to education since its inception. So as the Director of Education in this center, I see our goals as being pretty straightforward. We want to deliver high quality, timely, up-to-date, relevant but understandable information to a broad audience. Now that audience includes everyone from patients and their families to their own practitioners, from interested lay public to policymakers, and from high school students to practicing physicians and scientists. Because this field of regenerative medicine is expanding so rapidly, our educational format will have to be such that it's easily upgradable and updatable so that we stay abreast of a rapidly expanding science. So to do this in 2015, we're rolling out a series of modules. The first one's going to be purely introductory for people who are really not familiar with the field and the science. The second one will drill down more on the essentials that were required for understanding the science, and to allow anyone who has an interest to delve further into it. The modules that will follow that will be highly specific, and they'll be disease-directed and targeted to specific defects and disorders. Now, our efforts this year in 2015 to roll out those modules will be directed at the general audience that I mentioned before, but also at our own audience inside Mayo Clinic itself, where we're particularly interested in educating our own faculty, of course, but also members of our 5 schools. And for example, the medical school currently has on its curriculum a selective, which has been well received, and we'd like to expand upon that in 2015. The graduate medical school at the same time has a program that they run during the spring semester every year. Not only would we like to expand upon that, but we're looking into delivering a master's level program based upon that. Speaking of a master's level program, we've also looked into the delivery of a clinical master's in many of the clinical sciences through residency and fellowship. And that will also be expanded to include our School of Allied Health Sciences. So if you look at it in aggregate, this is an exciting time. Our vehicle for delivery is primarily going to be Mayo Clinic online learning, but there will be hard copy material available at the various Mayo medical campuses. And it's incumbent upon our delivery to make an interconnectivity between the information we're providing and our consultative services, both in regenerative medicine consultative service and Ask Mayo Expert. And so with this in mind, again, it's an exciting time. I believe regenerative medicine is poised to change the way healthcare delivery occurs in our country. Knowledge is also always strength, and education always benefits everyone involved. And we're dedicated to making that education a reality. Thank you.